Once again, we're back on Boond T Talk Train of Thought with a series of episodes with Dr. Sandhya Saharan exclusively on this T Talk Boond. She is a gynec. Ma'am, welcome back to this T Talk Boond.
Thank you.
Now, in fact, on this episode, we'll be taking us more insights in terms of reproductive health, or let it be in terms of contraception, birth control, or in terms of breast health, or cervical cancer, which is a diabetes, and the fertility. And I'm sure the kind of insights given by Dr. Sandhya Saharan will be more beneficial for the target audience at large. I'm sure that the various issues and the problems which are there, which can be addressed on this T-Talk Boond. So we'll have a conversation with Dr. Sandhya Saharan on this platform as far as the reproductive health which is concerned.
Doctor, non-use of contraceptive methods, use of less effective methods, incorrect and inconsistent use of methods. All these leads to high frequency of unintended pregnancy. So doctor, what would you like to share on this?
This is a very important topic. I believe contraception is something which should be definitely taught in the school curriculum itself.
Okay.
We are seeing an increased incidence, the age of sexual promiscuity, as well as the youngsters are more sexually active at a very young age.
True.
Initially, it was seen more in the West, but now this is a global issue.
Correct.
As the social dynamics are changing, so is the fabric and the sexual practices, that is, we are seeing more prevalent even amongst school children.
True.
I would say it is very distressing.
Yeah, true.
Because as we say, the age where it is like, it is 18 when you are allowed to, indulge in sexual practices. But if any youngster who is say 15 or 14, we are seeing teenage pregnancies also. So this is a dilemma. It is a huge social problem.
It is.
And I believe that there should be proper education about sex and contraception given in school itself, which by and large is not implemented in the school curriculum. But as gynecologists, we are separately going to schools and having programs where we are trying to address these issues.
Okay.
Coming to that, it is very important to make the right choices. Now, as the girls attain puberty, nowadays we are also seeing that girls are achieving puberty at an earlier age. That is because of various social factors, environmental issues, eating habits. So they are getting puberty by say around what used to be 12 onwards. Now we are seeing girls as young as 10 and 11 achieving puberty.
True.
And it is not that, only in the first few years that they generally don't get pregnant, but they can get pregnant when they are 14 and 15. So if they are not aware about contraception, if they are not aware about sex, then how are they going to avoid these problems? Yeah. So we need to sensitize both the girls as well as the boys. Both are equally responsible for contraception. It is not only the girl who is responsible, but even the men. We say they start from boyhood. So you should learn to have safe contraceptive practices. First of all, you should know the choices we have. Now, by and large, there are 2 or 3 methods of contraception. First, we say are the barrier methods.
Okay.
Now, barrier methods, like we all know in normal language, it is condoms. Now, we also have the female condom, which many may not be aware.
True.
But yes, for the past many years, the female condom is also there, very effective. So what was traditionally used only as male condoms, now the girls also have a choice. So there are many types of condoms which are available abroad, and many places you have it available in vending machines also. And I would say in colleges also, I think just across the colleges, they have all these pawn shops, they sell condoms also.
Okay.
So that is something, which I came to know only when I went and I was giving lectures to some colleges, and I saw that this is what happens, which I believe is okay, because if they need it, then they should be able to procure it. If you are not going to have an infrastructure, it used to be, they used to have these ads, and even in movies, if a boy or a girl would go to buy a condom, it used to be something like you're buying a sanitary napkin.
Yes.
Very much of hesitation. You're like, you
Shame.
don't know how to, and then the shopkeeper looks
Yeah.
at you. So this is something, overall the picture, the dynamics have to change. Society has to change. It is a natural act.
It is
A sexual act, a sexual desire is a natural desire. It is not unhealthy. It is not wrong. But it should be done at the right age, at the right place, with proper precautions. Now I'll tell you why in detail. Because, there are a lot of viruses, especially the human papilloma virus, which is responsible for cervical cancer.
Oh.
So cervical cancer is one of the foremost cancers in young women, and it is preventable.
Okay.
If you can prevent the HPV infection, of course, now the Indian government is coming forth with the HPV vaccine.
Okay.
It was always there, but it was being procured from sources from outside. It was very expensive. And it is there in many in the immunization schedule in many countries, but it was not there in our country. And we as private practitioners, or even in hospitals, we were giving it when the patients were asking for it, or when the mothers would come with the young doctors, how to prevent cervical cancer. So there were two types of vaccines, a quadrivalent and a bivalent. So we were giving it as and when there was a demand.
Okay.
And in many programs, I gave a lot of awareness talks on cervical cancer. So I was also speaking about the vaccine. See, prevention is better than cure. So the problem was the vaccine was very expensive. Each vial, each dose is very expensive. Cannot be procured by everybody. And there were a lot of issues concerning this efficacy and efficiency as well as the safety. So now all that has been addressed, and the government has come with a very competitive, very low cost vaccine which is now launched, and it is going to be prevalent in most of the hospitals very, very soon.
So awareness has to be created.
So this is very important that everybody should know that there is a prevention. So this is a virus which is very responsible for cervical cancer. So if you have a vaccine, if you engage in safe sexual practices, now definitely it is sexually transmitted. So if you are going to use a barrier method like a condom, then you are definitely safeguarding yourself from that. Also sexually transmitted diseases. Many a times, there are people who frequent with sex workers, and then they may contact a virus, or they may have multiple sexual partners, which is the norm nowadays. So then what happens is you will end up getting a what you call sexually transmitted disease. There are many types. So that is also something which can be prevented by using barrier contraception. So that is the most prevalent form of contraception, because it is only used at that particular instant when you are having the sexual act. If you are, what we say, you should be equipped. So you should have the condom with you whenever you plan to have intercourse. Especially do not engage in sexual activity before the age which is right. If you are engaging, see that you have the requisite precautions. We say you should use precautions. Have safe sex. And we definitely say have it with only your partner. Please do not have multiple partners.
This is very important.
Because it is not only physically wrong, but it also affects your mental health and your social interpersonal relationships.
True.
So this is one thing. A most important method of contraception is barrier. Secondly, we have many devices like in women, but generally they were used like, we say in modern language, copper T.
Yes.
It is an intrauterine contraceptive device.
Okay.
We generally used to put it after the woman is finished having her first child.
Child. Yes.
It is like an interval contraception. So when you finish having your first child, maybe when the uterus is involuted, say 40 days, or you give that time for the uterus to come back to size. Then we would put in a copper T. Yes. Because in our country, what happens is once the woman goes home, once she starts her life, going back to her household duties, taking care of a small child, then we see that they often get pregnant within the first year.
True.
And it is very difficult to keep telling them that you will start. They may think, that, okay, now I'm not menstruating for some time after delivery. They do not, it's called lactational amenorrhea. So they may feel, now I'm not going to get pregnant. But they do get pregnant because ovulation can be erratic. So we used to have this in most of the government hospitals, public hospitals. It is always once the delivery happens, we are like teaching them that this is the contraception which you should practice. In fact, everybody is given a written note that please come back after 40 days for contraception, or please do use some form of contraception. This is one modality which is available.
Yes.
Many women have like lot of myths that no, copper T causes bleeding, I will gain weight, and they have lots of problems accepting it. But we give them the proper knowledge. We tell them that we are here to address the issue, and if there is any problem, we will take care of it. So this is something which we need to teach them. That they have to be careful. And then if they are opting for other methods, well and good. Some people like to use what we call as oral contraceptive pills.
Okay.
Now this is also something which is very, very common and it is very effective. But using an oral contraceptive pill comes with a certain kind of what we say precautionary measures.
Okay.
Because these pills are containing hormones called estrogens and progesterones. So these are hormones. So there we have to rule out if there are any contraindications.
Okay.
Some people whose mothers or who have a family history of very high blood pressure or liver disease, or who have had strokes, cerebrovascular accidents. In those we have to be very careful because there can, be a problem that it can get aggravated.
Yeah.
And we need to have a baseline. We need to sort of do a screening first.
Okay.
They should come to a gynecologist, take contraceptive advice. We take a detailed history. If they have a family history of these problems, any malignancies, then we are very careful as to which kind of contraception we are prescribing. So I always tell people, please visit a gynecologist, take proper contraceptive advice, and even pills, the gynecologist, we have so many pills to choose from. Estrogen, progesterone, estrogen, only progesterone. So for which person we customize and we give.
Correct.
There are low dose pills, high dose pills. High dose pills by and large are a little, we have sort of weaned off because they have more side effects. Now we have effective low dose pills.
Okay.
So they have less side effects like, weight gains, headaches, whatever, bloating and all. So very, very effective and very useful. So there is so much to choose from. So making that informed choice is important. Please do not take pills on your own. Take pills only under prescription.
True.
Because you need blood tests, you need screening, and you need yearly monitoring when you're on a pill. I know people who take pills for 10 years without going to a doctor saying, no, once Likha, I am very comfortable. That's not right.
Side effects.
Side effects, suppose you land up with some kind of malignancy.
Correct.
It may not be because of the pill, but it can be because of some other reason. But then you should be monitored. At the same time, we need to understand that besides the pills, there are also injectable methods. These are also hormonal injections.
Okay.
But there are something like 3 monthly injections. These are depot preparations, which are sustained, they act for a longer time. So there is an injections also, which can be given. Initially, we used to give something like sequential pills, or we would give jellies. There were a lot of things, but then we have to customize what is useful for whom. There was something like implants. We used to have implants which were put in the forearm. When I was studying in KEM, then that time there was something like an implant which was very much in vogue, but it was little more invasive. So over a period of time, it was sort of weaned off. But now again they're coming into vogue because these implants, they're staying for a longer time, for 5 years. We have contraceptive devices, intrauterine, which stay for 10 years.
10 years.
So suppose someone's had one child and they do not want to have a second child. So it's a very good mode of contraception.
True.
So these things.
And safe also.
Very safe. Implants, intrauterine devices, barrier methods, jellies. There are so many things which you have, which you can choose from. So, but you should remember that you should take it under supervision. The biggest problem which we are seeing nowadays is something which is called as emergency contraception.
Okay.
You know,
What is
suppose
that?
Emergency contraception, I'd like to elaborate a bit. Suppose somebody's had a sexual act
Okay.
and you're not having any, you've not used any contraception, you've not taken pills or condoms or something. And you say, oh, I don't, I don't want this pregnancy. So within 72 hours, there is a pill which you can take which will prevent implantation.
Okay.
So this is called, but it is a high dose pill.
High dose pill.
So what happens is I'm seeing a lot of misuse.
Okay.
Once in a while is fine, but you can't have it after every episode.
Okay.
Because what happens is it alters your metabolic system.
Of course.
It alters your cycle. It causes a lot of irregularity in the subsequent cycles, and it has an effect on the body. So we say use it only for the terminology emergency.
Emergency.
Do not make it as an every time affair.
Okay.
This is a big challenge which most of our gynecologists are facing.
Okay.
That people are misusing emergency
Misusing.
contraception because it is mostly available on the over the counter.
Like sleeping pill.
Yes,
For sleeping.
like sleeping pills.
Yeah.
See, everything is available, but that doesn't mean you misuse it.
Misuse.
There is certain reasons why these are manufactured to help you.
Help.
Contraception should be seen. Now we have to understand. We have to behave responsibly. You're old enough to have sex, so you should also have the responsibility to have safe sex. If you are going to indulge in all kinds of wrong sexual practices, you will end up getting diseases. You will end up getting unwanted pregnancies. Now, we all know there is so much of, a turmoil regarding abortion.
That's
Half
very-
the world is against abortion, half is for. And abortion is not something which is easy or which is something which we advocate. It is only as, a mode where you've landed up with a situation where you can't get. So this is something which a woman has a right over her body. That is why we have that thing in our country. They are blessed that they have the choice. But it should be used only and only when it is absolutely, there is no other way out.
No other way out.
So we should make people understand.
Understand.
There are
That is-
people who says, "तो क्या हुआ? Pregnancy हो गई तो abortion कर लेंगे." That should not be
that
the
is their,
attitude. It is very distressing
mentality.
when I see young people coming, who are recently married. We always say when you're getting married or when you're planning to have, even not only marriage, nowadays the institution of marriage is like, sort of getting marginalized.
Yes.
So when people are planning to have, a relationship or stay together or whatever, so it is always better you visit a gynecologist.
That is
Take
very
an
important.
opinion.
Correct.
And then, go ahead. Because then if there is a problem, somebody who's there to help you out.
Correct. So people need to understand. They need to be guided well. So for that, they need to go to gynecologist.
Absolutely. You can go to even, I would not say only gynecologist, even a family physician is good, they can also counsel you.
They can
But
counsel.
only when the family physician feels that, okay, there is a certain contraindication or there is some factor where maybe they should take a gynec opinion, then maybe he will say, no, you better take a gynec opinion.
Correct.
Because by and large, even a family physician can give good advice.
Yeah, that is true.
It is not only, but gynec, see, suppose somebody, like I said, they have a hypertension or they have some disease in the uterus or, there is a lining issue or some fibroid or something, then they may say, okay, no, better you take a gynec opinion.
Doctor, thanks a lot. You have given so many insights on this question itself. We have given full information, which is so very useful for all the people. And I think they should benefit from this interview of yours. God bless you. Thank you.
Thank you. I really hope people take the benefit because contraception is something which should be practiced very safely and prudently.
Thank you, Doctor.
Thank you.
Doctor, it's an excellent insights to what you have given for young audience today. Maybe many a times like you indulge into this kind of practices and where you don't know the method and you land up into an unintended pregnancy and which creates a lot of social issues which are there. And I'm sure this is what ttalk platform is all about, where I think experts like you come and share the valuable insights. I'm sure like the target audience who are listening to Dr. Sandhya Saharan on this ttalk Boond Soch platform, I'm sure the tips given by her, how to take a precautionary measure once you indulge into this kind of practices, what are the best methods which are there. I think if once you take a precaution, I'm sure it's going to be a healthy life altogether. Ma'am, thanks a lot for giving a valuable insight for target audience. God bless you in abundance.
Thank you so much.
Thank you very much. Thanks.